living in a world where almost everyone that you talk to and love has HIV or AIDS. That means that you, your future children, or your grandchildren could have this virus. The Alliance Healthcare Foundation needs to help make more needle exchange programs throughout the nation. First, we'll talk about why this needs to happen, and then we'll talk about how we can make it happen. Stated on sandiego.gov, the official city website for San Diego, published in 2013, 1 in 5 people have the HIV or AIDS virus, and they are an injecting drug user, or IDU. They continue to say that every year, 5.9% growth happens within the population that receives AIDS or HIV in cities without needle exchange programs. The aforementioned continues to mention that in San Diego alone, 20 per 100,000 people have the HIV or AIDS virus, and that's only the 3rd largest statistic in the country right now. This isn't only happening here though, it's happening all around the world. According to the World Health Organization, our WHO.International, published on January 2013, in Eastern Europe and Central Asia, over 80% of their population is living with these viruses right now. And the aforementioned continues to mention that in the whole world, 16 million people are living with this, 3 million of them being IDUs. The worst thing about these viruses, though, are the risks that are associated with them. According to AIDSmap.com, which, according to Information Statistics, is a reliable health research website, over 43 years, where you only have 43 years worth of treatment once you are infected with these. After those 43 years, there's nothing else they can do for you, and you just wait to die. They also conducted a study on a group of 20-year-olds who were infected with these viruses, and 8 years later, they were all dead at the young age of 28. Now that we've looked at why we need these programs, we can look at how they can be established. So according to advert.org, an international HIV and AIDS organization published in 2013, that the resources for this would just be in a smaller environment, and it would be a group of 5 to 6 people standing in line waiting for IDUs to come through. When they come through, they pick up new needles, condoms, alcohol wipes, cotton swabs, anything to help make their injecting more safe. They're allowed to stay at the site and inject there so they aren't in fear of getting caught or being judged by other people. The aforementioned continues to say that they would be run by medical staff along with the help of volunteers. It would happen once a week, and there would be people there like therapists and psychologists to help them understand why they do this and to try to help them get over their problems. A big thing that came up is the funding for this. Well, the aforementioned goes on to say that in many places in Europe, the government actually helps pay for some of this, along with hospitals, because they see it as a big benefit. And even here in the U.S., our biggest exchange program in California, the community members help pay for this because they know how much they benefit from it, as well as with the IDUs. Since looking at this, it's comparable to a lot of other places that already have these exchange programs, so that's why it'll work. According to HPC, PSCI, or the HepCProject.org, published on December 12th of 2012, Amsterdam's long-established needle exchange program has virtually eliminated HIV transmissions there. And that's amazing. We could do that here as well. It continues to go on to say that there's 123 cities already in the U.S. with needle exchange programs. This just goes to show that this is a very plausible thing that could happen because we're already on the right track for it. We just need one more big push to really get everyone out there and helping with it. The biggest thing that people will gain from this is a sense of security, and they no longer have to be in fear of getting this disease. According to WHO.International, published in January of 2013, the 2 biggest groups at risk for these viruses are unsuspecting sexual partners and children. That's because children can be born with these viruses, and it's very hard to realize or notice sometimes when you have these viruses. So that means if you have a male and a female, and they have unprotected sex, they can pass it to each other, and then the more they have sex, or they have kids, they can keep passing it and passing it. So you can see how it just never ends. So there are many IDUs out there who have the AIDS and HIV virus. With the help of volunteers and medical staff exchanging needles with them once a week, we can help to bring that number way lower than it is now. The Alliance Healthcare Foundation needs to help establish more needle exchange programs throughout the nation. First, we looked at why this needs to happen, and then we looked at how it could happen. So the next time that you think about your future, are you shivering because you know that you're going to have HIV and AIDS, or is it not even a thought in your mind?